So hopefully in this session, we're going to cover a few of the pros, the cons, and also how you can do it a little bit more effectively. So that's what we're going to cover today. So why engaging with your patient population can be effective. Definitely going to look at some of the pitfalls, and then we're going to look at how you can do it. And then, as usual, I'm going to offer a few tips and tools that I like to use that hopefully will streamline the whole process for you. There's different reasons why we might want to engage with our populations. So the first one is kind of termed under engaging with the community. We have a presence in the community as a general practitioner, whether that's as an individual or as a practice. And I'd probably view this more as a practice effort. But people look to us for information. We've seen that over the pandemic, that our patients trust us to offer healthcare support and advice, and actually that they trust the information that we give them more so than often when they even get it from central services like the government and that kind of thing. And it's important to recognise that that's a key point, that how we engage with our communities comes from that element of trust, whether that's individually or as a practice. Engaging with the community can really help in other ways. I'm going to use the pandemic a few times over this to give examples. And one of the ones that was very personal to myself was the generation of PPE. So obviously when the pandemic hit, getting access to PPE was a challenge for many practices. And particularly the level of PPE we were provided sometimes was maybe not where we would like it to have been. And having the support of the community to actually help us create additional PPE. So I worked with a few of the maker communities in Nottingham, and we actually started producing additional visor shields for us to use through practices and through things like the CMCs and that kind of stuff. And that came from that engagement with the community, saying that actually we've got real challenges, we need our help, we need help to do this. And the community responded in their droves, so having, communities of people helping to support us. And even if it wasn't, PPE, it was other things like helping us to support our more vulnerable patients, helping to deliver medications, supporting their neighbours. That was stuff that we were able to help encourage and incorporate. And it's also having the support. So again, personal elements. Many people in Nottingham know about some of the challenges that some of the practices across Nottingham have had with, for example, in NHS property services and similar things along those lines. And about 3 years ago, we went public with the challenges we were having with our patients, because actually we felt it was time for them to know. And the most surprising thing that happened as a result of that is that throughout all of our discussions with all the various bodies involved in that whole process, nothing really changed after 6 years. It was when we went to the patients and got them on board and explained to them the situation that actually things started to change. We had much better involvement from counsellors, from the council, and from other organisations, and that was being driven by the patients who were concerned about the well-being of the practice and obviously the future of it. And it wasn't until we got their support that that was able to change. So it's important to recognise the power that the support of your patients can really have for the practice. I guess for full disclosure, I'm still going through that process with NHS Property Services. That's not because we've not had the patients supporting us. That's, as usual, down to bureaucracy, I'm afraid. Next up, why? Well, I term these ones under sharing information, and there's various different ways that you can share information, and quite a few people mention that in the Mentee about it's a great way to do so. I think there are different ways you can look at this. So one I like to suggest is sharing information about your staff. Now, I don't mean personal details and all that kind of stuff. What I do mean is things like your services that you're offering, changes that you're having to go through. And again, COVID's a great example. We had to change the types of staff members that were available because of things like shielding, because of the types of services we could offer, and explaining that to patients can be a really effective way to help get them on board. Particularly with a lot of the newer roles, for example. To be honest, how many clinicians here know what a physician's associate can do or what a physiotherapist can properly do? Most clinicians struggle to know that. So how can we expect our patients to know that unless you tell them? So being able to share the information about what the different roles can do, whether it's, explain what your journey through a pharmacist medication review might look like, or how actually seeing our first contact physio can help you get the right kind of care sooner, that can be a really powerful message to share with your patients. Being able to share policies. So, we have to share various different pieces of information. CQC say we have to do so, but actually having somewhere where you can do that easily and effectively to your patients again, COVID's a great example. The reasons why we had to change the way that people came to our waiting rooms, the reasons why we have to have social distancing, various other kind of policies. One I share often, a lot more than people probably suspect, is our practice social media policy for patients, because actually we want to make sure we're safeguarding all of our patients. And I'm sure some of you have had situations where one patient's been recording another in the waiting area, and they potentially post that on social media. That's not good. And actually sharing with them the principles that it should be a safe space in the practice. There's reasons why that shouldn't happen. And, you know, having that kind of dashboard, that reference point for your policies, really effective, and also great to help share with patients when there's issues. And the last one I'm going to comment on about sharing information is wider consultations. Increasingly, as we move towards community and population-based care, there are increasing amounts of consultations that happen in the background that us and patients may not always be aware of, with changes to services and for other reasons as well. And again, personal experience, many people probably remember a couple of years back, there was the change of celiac medication prescribing in terms of the foods and that kind of stuff. Sharing that information with the patients was actually one of the most watched kind of posts that we had from the practice for a while, because actually there were patients where it was really pertinent to them to be involved in that process, and they wouldn't have known about that if it hadn't been the practice themselves that had been sharing that information to them. So it's a good way of trying to keep patients up to date in various service changes and that kind of stuff and consultations that are happening. And I've kind of touched on this already, but having a reference point. It's really important that you do have a reference point. NHS England kind of say we have to have some sort of online presence, and whether that's a website, whether that's a social media or something else within the long-term plan, because that's, we understand that digitization and better electronic access is one of the aims of the long-term plan. So having that dashboard of the services that you offer that you can reference patients to can be really useful and effective in terms of both dealing with positive patient experiences and sometimes even the negative ones. It's also a great way of leading by example. Many of you, I'm sure, have come across the patients that feel that they don't need to wear masks for whatever reason that may be. And there are definitely genuine reasons out there. But we also know medically, actually, there's very few of those reasons. So having a reference point where you are leading by example and showing patients that can be a useful way to engage with your local population. So next up, that's what I've kind of covered so far. We're now going to go on to the pitfalls. So when I've kind of done this before and asked people, these are some of the other ones that I've come across that people are always worried about. So the complaint is often the first one I get asked about. So the issues of how can you deal with complaints and potentially even libel when you talk about it from a social media's perspective, because it is written down and therefore technically can sometimes be construed as libel if it's inaccurate information. It's a definite challenge, and I think there are things that practice can do to try and mitigate some of this. A lot of it is, to be honest, trying not to react to the comments, because that first reaction you get when you see those things is no, trying to respond to it, trying to engage with it, trying to sometimes even challenge it, and often having definitely someone who's not directly involved in the situation respond is always more effective. But also having a pause to deal with the complaint itself is often more effective, particularly on a social media perspective, because you may get these, for example, at 7 o'clock in the evening when the practice is shut, and you shouldn't really be responding because the practice is shut. Recognizing those kind of elements. People are often worried about sometimes engagement can lead to another lane of contact. So if you have social media profiles for the practices, or if you have different routes that patients can engage with you, can that be another lane that they try and use for access and demand? I know many people are concerned about that when it comes to things like online consultations, for example. And this can sometimes be used by patients as that route. I've had that exact experience with a few patients trying to ask us, for example, about vaccinations and that kind of stuff through social media platforms. And the key point is trying to direct them back to the proper methods, because one thing to remember, social media platforms in particular are not confidential in any way, shape or form, no matter what system you use. Impact. So this is one that I think people don't always realize. The actual impact you have when you engage with people can be varying. You may have a throwaway comment that has the most impactful element to a patient without even realizing it, and vice versa. You may spend a lot of time and effort doing something, and you're actually only speaking to 1 or 2 people as a result of it. And then that can really be disheartening in terms of, the effort that you put into it and the result. But one thing to remember, the impact may not always be noticed straight away. We live in a society where, almost instant impact and gratification has become the norm. We see that with social media, we see that with responses, and we definitely see that with the bureaucracy that we have to deal with from the NHS. They want results yesterday. But impact can be felt a lot later down the line, and you don't always know the impact you have with individuals because you may not always find out about it. So that's one to always, I think, to park a little bit because it's an interesting pitfall. This one's been mentioned already, time. Engaging with patients, particularly through communications and that kind of stuff, can be an absolute massive time sink. So I'm hopefully going to give you some tips for how to prevent that from being the issue. We'll come to that a bit later. But one thing I will point out, if you want to do this well, you do need to actually dedicate some time to it. This is not something you can do in addition with the thousands of other things we're trying to do and just kind of squidge it in some way. You do actually need to think about dedicating some specific time and resources to doing this properly. Otherwise, it's just not going to be effective. And how you do that, obviously up to the practice. And we'll come to that in a second. I'm going to talk about a particular phenomenon, and there's 2 phenomena actually we're going to talk about. One is the concept called a Twitter storm. Now this you may have heard of, you may not have done. It's unique pretty much to Twitter, but can occur on any social media platform. And this is also known as the pylon phenomenon. So, comment is made and suddenly you have loads of people jumping onto a bandwagon, trying to raise positive or negative implications from that. And that can happen in various different ways, from a supportive element, but also from a negative one. It can also be a way for people to push agendas as well. And you can even see people ganging up on, situations and that kind of stuff. And that can often happen. So understanding that phenomenon and also knowing how to challenge it and to stop it is really important. And those skills that you can have to do that. And we'll cover that briefly in a second. And fake news. So having done social media for a while, fake news is out there. We know that specifically, obviously we've seen a lot of that with things like COVID and the vaccines and the efforts that many of us are doing to try and safeguard our populations. And we're having to tackle that information. I do think some of the stuff we talked about earlier about being that authority, being that, that place in the community to speak from can help us tackle this, because this is a real challenge. Dispelling myths and fake news for our patients is something I think that when we can do it really well. Again, it feeds into some of the other things we talked about time and resources, but it can actually have a huge impact when you do get it right. And it's something that we clearly need to be aware of. So those are all kind of my pitfalls that are covered, and glad that we've covered some additional ones in terms of things like the PPGs and that kind of stuff. So moving on to the next question, which is how. So how are we going to tackle these? And I'm going to talk about this one first because it's the one that everyone always mentions, PPGs. So PPGs are potentially a really good way of engaging with the community. The challenge, I think, often with PPGs is first of all, having one. You may work in a practice population where getting people onto your PPG, that in itself is such a challenge that it's just not doable. And then the second one is having the time to engage with the PPGs as well. Because again, we're busy, it's chaos at times, and actually having that kind of time to spend on it can be, let's be honest, sometimes draining. I think the important thing to know about PPGs is that they can become a focus group for people wanting to either push their agendas or share the kind of information that they want to share only. Ways to get around that. So a couple of things that we've done in the practice. So number one, having ground rules and explain those ground rules at the start of the meeting are really important. And you do that every single meeting. That is something you can't forget, because you may have additional people joining, even if it's just reinforcing those concepts and stuff for each individual meeting. It's really important that happens, and that is an absolute must in my book, and that can help to try and mitigate some of the issues. And what you tend to find is if you do that on a regular basis, you then actually get the group themselves supporting those ideals over time. Again, impact isn't immediate. It can take time for that to happen, but you will find that is something that people adhere to. there does need to be a bit of facilitation, but that doesn't mean that it has to be the practice that's running the meetings. So yes, the practice be involved, that can be useful, helpful, and to be honest, it should also be the way I would recommend doing so. But that doesn't mean that you run the meetings, actually finding that individual within the group themselves that is happy to take on that role. And yes, again, there may be an element of an agenda in there, but actually it's give and take, it's a compromise. In terms of the makeup of the PPGs, I'll be honest, it's always going to be a challenge. You're never going to have a perfect spread of your practice population because that's just not the way the world works. However, one way I've found when we have had people that are, to try and diversify the PPG. So one is challenging those that have complaints against the practice and saying, actually, if you want to help us change and, understand your needs, why don't you consider joining our PPG to help us understand your particular needs and sharing them, because we kind of listen to our PPG. That's the voice we're using to help understand how we provide our services. And actually, that's the best way to help provide that voice so we can meet your needs better. And, I've shared that with many patients when they've had disagreements with the practice about issues they may have had where it's down to simple things like prescriptions or more complicated things. One of the standard offers that, I've made to patients when we've discussed that is, do you want to join our PPG? Now, I guarantee you there's some of you out there thinking, oh my God, he's an absolute loon. Why would you want to do that? Yeah, okay. It can be frustrating. I'm not going to deny that at all. But I think one of the things to remember is that if you give someone the challenge of improving something, they'll either take it on because they genuinely want it to be better, or they'll ignore it. And as a result of that, it's a bit easier then the second time around it comes to say, actually, well, this is our way of trying to change things, help us do that. And giving that back to the individual often leads to them wanting to have a better impact. Like I said, that's my individual experience. It takes time, I'm not going to deny it. And it does take a little bit of talking to, but actually it does mean that you can engage people to participate. The second part of that is not trying to stick to strict and, regular timings and all that kind of stuff. There does need to be some flexibility. There's no point having all your PPG meetings during working hours, because then there will definitely be proportions of your patients who will never be able to attend because they're off working, they're busy. If you're going to have to, if that's the only way you can do it, try and look at different ways. And we're going to talk about some of those different ways a little bit later on. But engagement doesn't have to necessarily be physically meeting in a room. We've all found that out. The pandemic has shown us that you don't need everybody in the same room at the same time to have a meeting. So remember that one. Next up, so I can see some comments. I'll just see what they are. Yeah, so definitely the comment about inviting the individual agenda. Yep, I completely agree with that. I think, again, that's where you've got those clear, guidelines at the start. So, that obviously not to share personal information. That should always be emphasized in every single engagement that you have. Not about trying to push own agendas and having that in there, that, you shouldn't make the care personal to yourself. You could even have like a charter that you ask patients, and I know some practices have done this, where that in order to join the PPG, the members are asked to sign up to a charter. So not necessarily a contract, but just signing up to the ideals of the PPG to try and make it better for the patients as a whole. But it's important to remember the benefits of PPGs can be really effective. We've had events, I'll be honest, pre-pandemic, because they were physical events, where we've had, for example, a giant bowel in our waiting area to help encourage bowel screening programs, and having our PPG help and support that was really effective because they got involved in the aims. That actually them talking to patients was more impactful than clinicians talking to patients, because they were saying, well, yeah, we've done this and have a look at it. And similarly with our flu campaigns, pre-pandemic, because this was all physical stuff we did in the waiting room, that, having them help support patients to understand how to, why they're coming their flu jabs, direct helping to chaperone, not chaperone, what's the word? Coordinate, I've forgotten the term, sorry. But, helping the flow of patients, that was really useful and stuff as well. So absolute and definitive benefits that you can have, as well as the perspective that you get from those patients engaging with your practice and the services you're offering. Real-time feedback. So feedback itself can be a really important way to try and understand and engage with your patients. And there's different ways you can look at doing that. The friends and family test, I know, is one that many practices do. It's often a small box on the side with some forms next to it. How often are you normally suggesting to patients to consider filling it in. And to be honest, you can also think how much value is it actually giving you. I'm not a big fan of the friends and family test because I don't think it gives meaningful information about how you can change things. What I tend to prefer is trying to direct patients to give us feedback in different routes. So even pre-accurates being a thing for practices, I would often send patients an SMS link with going to, for example, our feedback page on NHS Choices and suggesting to them, if they wanted to give us feedback about issues, whether positive or negative, actually that's a great way for us to understand it and report it. And actually that led to, positive changes with some of our feedback. You can use a little bit of NLP in there. So things like using short links to code. So ours is actually, when people click on it, it's rate Wellspring 5 stars. So that's the short link they actually get. So just a tiny little bit of NLP in there to suggest maybe actually if you had a good experience, give us the 5 stars, not the 4. It works sometimes. And one that, again, can be quite useful is creating your own feedback stations. So many of you who've probably been to IKEA have seen those lovely little things that you just click, quick, short engagement about your experience. If you want to see how to do that, my colleague Andy Foster, who does a lot of the GP learning stuff with me, he's created a video that shows you how you can create your own if you want to do in the waiting area. Obviously, right now with the whole pandemic, touching objects and all that kind of stuff may not be the thing we want to focus on, but that's a really good way of getting real life-term feedback from patients, because actually feedback is always much better if you get it live at the time the experience has happened rather than later down the line. Website. If there's one place you're going to have a look at, this is something I would recommend most practices consider. Having a usable and effective website to help coordinate all the other stuff I'm going to talk about, it is an absolute must. And it's the main way that patients will now engage with practices, especially as we move towards online consultations. The landing point for many patients is going to be the practice website where they start on that journey, whether that's about requesting their medications, whether it's about engaging with online consultations or various other routes. So take advantage of it. Use your website as that information source to help educate your patients. And that can be just the website itself. It can be through other routes as well. And there's one in particular I'm going to recommend everybody should be doing by the end of this talk, and I'll explain why shortly. But it is the easiest way to do that because there are actually now a lot of website providers that do a lot of the hard work for you. So they will provide you with information routes to share NHS UK information. They can help do a lot of your protocols and reference points and that kind of stuff automatically, and build all of that stuff into your website. So you don't have to do a lot of this stuff, and they can even personalize it and things. And it's part of the engagement elements with practice that I think many of us don't often think about. But it's important to remember that most patients nowadays, when they're looking for how to engage with your practice, if they don't have your number stored in their phone, which you'd be surprised a lot of them probably don't, first thing they'll do is they'll type in the practice name on Google, and that will bring up normally, or should be, your practice webpage as the first option. So that's where they're going to go. So it's important to make sure you've got good representation, good presence there to help direct patients when they're trying to find you. Social media. So I'm going to talk about social media a little bit because I spend most of my time on social media. I can see some friendly faces, and they definitely know that I often comment. I've got the internet plugged into my brain, and social media is definitely one of them. But I think social media is something that many practices and clinicians are fearful of using because of the negatives, but actually can be a really impactful way to engage with your populations. For the past 76 days, I have been blogging on almost every platform I can about my journey with the COVID vaccination, which I share with our practice. So I share on our, our practice, Facebook, Twitter, that kind of stuff. And I've had, patients I've then subsequently spoken to said, oh, so you had the vaccine. I saw that video. And that's a landing point for me to then start talking to them about their concerns about the vaccine. And it feeds into those elements of, leading by example. It feeds into that whole concept of the authority and the trust that we have with our patients. You don't have to do every platform that's around, and you could do if you want to. I wouldn't recommend it, to be honest, because it's just massive time sink. But engaging with social media can be a really useful way to coordinate that. I'm not going to have time to go through all the pros and the absolute ways of doing that. But if you did want loads of tips that you can get in a really short space of time, check out those couple of videos that I've got there. I think in total they're about half an hour or so, and it will have almost everything you need to know about using social media with your patients and stuff for various different rules and things. And one of them was actually the last meeting I had with the OMC. So yeah, feel free to have a look. In terms of the links for all these, you'll get these afterwards, so don't worry about that. But yeah, there are different platforms around. And I said that aside from your website, there's definitely one that I would recommend every practice does look at. And it's going to surprise you because it's not going to be the top 4. So the one social media platform I would recommend every single practice has engaged with is Google My Business. And it's one that many of you probably think, well, I don't really know what that is. So I mentioned earlier, when people are looking for something, they typically will type into Google, and Google will bring up a few options. And if they get the name right, it should bring up the first one. So for example, if people were to put Wellspring Surgery into Google, what should come up as pretty much the first option is my practice. And on the side of that, if you're looking on a web browser or if you're looking on your phone and things, will be the practice opening times, and the practice telephone number, and the practice website. And that's because Google has indexed what's called your Google My Business profile. And controlling and coordinating that is really useful way of being able to direct patients to understand what to do with your practice. The reason I say that is because majority of people, like I said, will search for it and find you through that route. It can even give you really basic metrics of demand. So I know, looking at my Google My Business account, how much extra phone demand we get of people searching for our practice number on Mondays compared to Tuesdays compared to Wednesdays, and how many people are still trying to do that the weekend, for example. And it's a way that you can share information with the practice population as well, because Google My Business has an option where you can share updates from the practice, and then they ping up for 7 days, and then that's then gone after that, and you can then create processes along those lines. But the main reason why you need to do that is because there are places where other people have done that for practices that don't actually work at the practice. So they control your Google intel about your practice. And that's not a good thing, to be honest, because the person that should be controlling that is absolutely the practice. And, you know, there are unfortunately negative stories I've come across where people have been, taken control of the Google My Business account for a practice and posting erroneous and false information. And it's really hard to change it back to the original owners after that point. So I would really, really recommend that something, and to be honest, it's something you can do once and leave it. If you don't want to engage with the platform afterwards, you don't have to, but definitely take control of your Google My Business profile as a practice, because once you've done that, it's a lot easier to keep control of. Importantly for CQC, you can show that you've done that as well. So you're doing that whole element of, well-led care. So absolutely have a look at that. And if you want more detail, literally how to walk through that, is a video there. Facebook, Twitter, and various other platforms often come up. I'm going to talk about them briefly. So I use Twitter a lot because it's quick and easy, but it's more of a broadcasting platform if you're going to use it from a practice perspective. Facebook is the way that you're more likely to get engagement with your 30 to 50-year-olds in your practice. And Instagram's the way you're going to get a chat, engagement with the younger population. So it does depend who you're trying to target. If you're trying to talk to, your under 20 population through Facebook, to be honest, you're not going to get much traction. I put YouTube there because sharing information from the practice on YouTube can be a really good reference way of trying to tackle things, particularly if you've got changes in services. And one of the efforts we've got happening in our local network that we're doing is creating explainer videos for patients of how to use the practices that we'll be sharing, hopefully all goes well, within a couple of months or so. So then that they can share that with their patients as a video link to help them understand the journey, whether that's requesting their medications, whether it's requesting their appointments, whether that's asking for a home visit, or even what to do when the practice is shut. Having that kind of media to share with patients, done from a practice perspective and a local perspective, that's where you're going to get the better engagement. Newsletters. So we will all probably come across newsletters, and we'll probably all stick them in the bin as soon as we get them, or relegated to our junk box. that's the reality of the world. But actually having a newsletter, again, that you can offer to patients, whether that's a physical print one or whether that's an email one, and there are platforms you can use to do that with patients, as long as you're very clear about the way that you use that, and using things like autoresponders as a method to prevent patients sending you medical information is an absolute must if you're going to do that. But it can be a really effective way of trying to encourage that additional engagement with patients in terms of how they can understand the different resources that the practice may have. And more importantly than that, if you create it as a digital version, again, it's something you can reference back to when you have engagements with individual patients as well. And you can send that through bulk messaging, whether that's through things like MJOG, that kind of stuff, to patients on a regular basis, to keep them updated about your healthcare services. Because that's not considered spam, unless you do it every day. That's definitely spam. Don't do that. But, you know, once every couple of months, a brief newsletter explaining, you know, changes within the practice, changes within staff, how, you know, your online consultation system may have changed, what kind of, you know, policies have changed within the practice. That could be a really nice way to start to get that engagement with patients that is actually quite low intensity, because you just create it once and then, and you know, you send it out and then it's done. And you'd be surprised at sometimes the way that could be useful. Alternately, you can create a podcast. Now, I know there's definitely going to be people looking at me right now thinking, Gandhi, you're an absolute idiot. Why on earth would I want to create a podcast for my practice? Well, if you want, have a listen to that. So this is from a practice that have done just that, and the reasons why they did it and everything. So they've used it as a method to engage better with their practice population, to help them understand all the changes that have happened during COVID, and also to help educate them from a medical perspective. They actually cover medical topics as well that their patients may be keen to know about. So they've even done slightly more unusual things like Raynaud's and that kind of stuff. And it's a nice way of having that more personal connection with your patients that does create feedback and just encourages that whole community aspect between practice and patients. And to be honest, if you don't want to go off and create one, which I completely understand, most of you won't want to, don't. Borrow that one. It's created by doctors that are working and doing it for you. I mean, that's what I do. I actually share their podcasts with our patients every Monday, because they produce an episode then and send that out through our practice Facebook page, Twitter page. It's content that's automatically created that I trust, because I enjoy listening to it and I think it is useful and sensible. But I can share that, and the ones that are more specific to their local area, I just don't share those. I just share the ones that are topical based and that kind of thing, and that can be a nice and easy way to do things. And lastly, I'm going to talk about probably the scariest one that many of you will probably think, I'm not going to do that. Oh, sorry. If you did want to know how to create a podcast, I'm doing a session on how to do that later on, so feel free to join that. But live streaming. So if you want to get better engagement with your practice population itself, particularly the younger population, the best and simplest way of doing that is to live stream from your practice. And like I said, I know there's definitely going to be people thinking he's an absolute loon, I don't want to do that. But again, it speaks to all those concepts I mentioned about the authority, about the leadership from the practice, about engaging with patients, that actually going live and on the social media platforms can be a nice way to just speak to patients en masse in a controlled route. That means that you can have engagement with the patients as well and answering their particular questions. This is something I've done a few times with our practice population, and often a lot of the updates I give about our opening times or PLT times and that kind of stuff I'll do as a brief live stream, partly because the metrics are a lot better, but also because I'll admit I'm comfortable in front of a camera. But having the opportunity and seeing some of the comments that come down after that, or whether that's live or later down the line, can be really encouraging. And actually it can help you understand those kind of patients that do want to engage with the practice a bit more, which you can then contact and say, do you want to join our PPG as well? So it's a great way of trying to encourage people to join. I said I'd give you some tips and tools on how to do that. So if you wanted 3 tips or tools that you can use that are free, first of all, so you don't have to pay anything for these, those are the 3 I would suggest. So there's one called Publer, which is the one that I use to push and automate all the social media postings that I do. So I can post to multiple platforms all in one go. I can schedule it. I can do that. And it's relatively, low intensity and stuff. that's something that potentially an admin person within the practice can coordinate and do, half an hour a week, and you can load up all your posts for the next couple of weeks and then not have to worry about having regular content. If you wanted to create your own media stuff rather, and you don't feel you've got the skills and the know-how to do so, have a look at Canva. It's a really good online tool for creating images. So all the thumbnails, all the imagery, all that kind of stuff that I create that you may have seen, I use Canva for, and it is literally click and point. It's very easy to use. And if you did want to be a bit more adventurous and do the podcasting than the live streaming and stuff, I use a platform called StreamYard to do that basically controls all of it for you, makes it really easy, and means that you can do all that stuff without any real challenges. And the really cool thing about it, it works on our NHS IT computers. So you don't have to worry about having to do it from home or anything like that. It still gets around all the firewalls. Or, well, it's not really a firewall, it's safe to use in that respect. And then I can't show you images of it, but these two websites down below are really good if you're trying to plan content. So one is called Awareness Days. So we've all heard about, Cancer Awareness Week, or, Epilepsy, National Epilepsy Day, and that kind of stuff. And unfortunately, they change when they are all the time. These two websites will tell you when they are. So if you did want to plan campaigns within your practice, or, as a team, so classic ones that I know many practices engage with are things like Macmillan coffee mornings, that kind of stuff. These two websites will be able to tell you when and where they are. The reason why I put two is that the NHS employers one is probably the one I would recommend having a look at because it's free, and it gives you most of the NHS focused ones. If you did want some wider ones, the Awareness Day is quite good, but it limits how many you can actually look at on a day. So it times out after a bit and then you can't look at more. So that's why I put both of those on there. So that's what I've covered. I'm hoping this has been useful. I said I'd give you all the opportunity to get the links and everything else. So you can either go to that form there, or you can scan that QR code. I'll take you just to a quick feedback questionnaire thingy. And once you've done that, you'll get the links to this entire presentation, included all the inbuilt links and stuff that are there for you to have a look at and use and access and stuff. If you're looking at doing this from a practice perspective, I think there's definitely a difference between doing it as an individual and doing it as a practice. If you're doing it as a practice, it needs to be a practice initiative for a start. There shouldn't just be one person in the practice doing it, because if that's the case, they're going to get really frustrated and they're going to get really tired, and it just doesn't work when you're trying to do that, unless you're a social media nut like myself and that kind of thing. If you're doing it as a practice, get a couple of people interested in doing that, set aside just a brief amount of time. And like I said, something as simple as even half an hour once a month, to be honest, is a great way of starting, and using things like, platforms to schedule and automatically post stuff, just so that you can see the engagement you can get from working with patients. That's a great way of starting, and there's a wealth of content out there already, so you don't have to go off and create your own stuff. I think it's much more effective if you do, because then you've got that more personal message to your patients coming from your practice, but you don't have to if you just want to see how it goes and stuff.